That's right, doctor. Alcohol dehydrogenase is fomepizole, as rightly answered by few of our students. Dr. Madhuri also correctly answered it as alcohol dehydrogenase. Disulfiram inhibits aldehyde dehydrogenase. Tomorrow when you are sitting before a monitor to click the answer, you will remember me that day, let me tell you. Now doctor, zero order kinetics, what does it basically mean? Typically, there is a linear relationship between drug concentration and time, and the half-life of the drug will increase with the dose, and it is a constant amount of the drug which is basically eliminated per unit of time if it is a zero order kinetics. See doctor, if 100 milligrams need to be metabolized to 95 milligrams, how much it is decreasing? 5 milligrams. 95 to become 90, how much it is decreasing? 5 milligrams. For every 5 milligrams, if it is taking 1 hour time, okay, what do you call it as? Zero order kinetics. But if 100 milligrams becomes 50 milligrams in 1 hour, 50 become 25 in 1 hour, 25 become 12.5 in 1 hour. For every half-life, if same proportion, 50% is coming down, you call it as first degree, which is more rapid first degree. But unfortunately, most of the drugs, when they reach toxic doses, they behave zero order. The time when you want a rapid elimination, they behave like slow movers. So that is the unfortunate part. So in which degree order kinetics you want to prepare for the NEETPG now? First order, no more zero order. If required, second order, third order, fourth order. So that should be the line of spirit every day you must develop, doctor. Now, postganglionic sympathetic nerve, what does it basically produce? Adrenergic or noradrenergic typically? All the efferents of the peripheral nervous system are fundamentally cholinergic, except the postganglionic sympathetics, which go to the structures like sweat glands. They are not cholinergic. So that is a fundamental. Now, with regard to the drug, what is a competitive antagonist will be doing? Basically, when there is a competitive antagonist, you require a higher concentration of the drug to elicit a given response. So that is the reason the effective dose, which achieves 50% of the effect, will typically need to increase in the presence of competitive antagonist, is what need to be fundamentally remembered. I leave all the information, literature for you to review at a later point. Now doctor, the drug A by phase 1 reaction will yield the products which are less likely to undergo the renal tubular reabsorption, is the true statement. So fundamentally, what kind of drug metabolic reactions operate in our body? We have got phase 1 and phase 2. So phase 1 basically are the reactions where hydroxyl radical or a NH2 radical, they are the ones which are basically converted into the non-polar, they are basically detoxified. Whereas in the case of phase 2, what happens mainly is not redox reactions. What happens is conjugation reactions, glucuronidation reactions, they are all the part of the phase 2. Now give me one confident answer, doctor. Left horn of sinus venosus will be giving rise to which structure in the heart? Embryological left horn. Right horn of sinus venosus will be giving rise to which structure? Let me check how well you are ready for the exam. Yes, one confident answer. Left horn of sinus venosus. Who is going to give me the first answer, correct answer, or even a wrong answer? Left horn of sinus venosus. That's right. Guntur students say SVC is the right horn. Then what does left horn will be giving rise to? Let me trade answers with you. Anantapur also says right horn is SVC. So doctor, this is one table which you can't forget in the exam hall. Truncus arteriosus gives rise to ascending aorta and pulmonary trunk. Bulbus cordis will give rise to right ventricle and the smooth part of the left and right ventricle, outflow tract. Primitive ventricle gives rise to trabeculated part of the left and right ventricles. Primitive atria give trabeculated part of the left and right atria. Left horn gives rise to coronary sinus. Right horn gives rise to smooth part of the right atrium. One out of these embryological structures and their adult derivatives in the embryology of the heart will definitely come in the tomorrow's exam, which you need to be sure. Okay, 12-year-old boy who is on methylphenidate, and what do you basically expect in the intoxication? Methylphenidate is a drug which we use in the management of the attention deficit hyperactivity disorder. It can have sympathetic hyperactivity reactions which it can cause, which lead to hypertension, tachycardia, and seizures can be the manifestation. A farmer attempts suicide. What is the best option available for a farmer to suicide? The OP poisoning insecticides. So you need to give atropine and also PAM, pralidoxin. Now, prazosin is the drug which selectively blocks the alpha-1 adrenergic receptors, is what need to be remembered. Very selectively it will block. It is the salicyline which is considered the MAO-B inhibitor, specifically, selectively. In alcohol withdrawal and delirium tremens, we often give benzodiazepines, which are the treatment of choice. Now I am going to do some little trading with you all. When will bone marrow start blood cell production in the fetal life? Who is going to give me a possible, potential, strong, confident answer? Right or wrong? 6 months. Dr. Navya says 6 months. Hyderabad says 6 months. Guntur, very early, 3 months only. Bone marrow, they are expecting erythropoiesis. Dr. Chinna says 5 months. So doctor, this is important list. Few numerics which you need to crunch before DNB conducted NEET. Yolk sac 3 to 8. Liver 6 to 30 weeks. Spleen 9 to 28. And bone marrow 28 weeks onwards. You forget, you ask your friends to remember remaining things. You don't remember. You remember this, which is very important. Bone marrow 28 weeks onwards. Buspirone. What is the difference between this and other benzodiazepines? Buspirone is generally used for a mild short-term anxiety. But it does not lead to sedation unlike the benzodiazepines. And if you take alcohol and also take buspirone, it won't potentiate the action of others. It doesn't have any abuse potential. And there is no tendency for tolerance and there is no withdrawal. But what is the only problem with buspirone, doctor? It has a slow onset of symptoms. I mean symptom relief. It takes a week or two. So that's the reason. If 8 weeks entrance is there, this is not the right time to take buspirone. 2 weeks before is okay. Okay, so onset is very slow. Now, with regard to the loading dose, for which kind of drugs do you want to use the loading dose is a very, very fundamental question, doctor. Loading dose shall be given or not is basically decided by the half-life. If a drug has got a very long half-life, like amiodarone, the elimination T-half is about 58 days for it. Such kind of drugs are basically started on a loading dose, is what need to be basically remembered. Because if they have got a very long half-life, for you to bring any change in concentration, it takes a longer time to achieve the steady state concentration. Hence, initially you give some loading dose and then you give the drug, maintenance dose. Suppose if the drug has got a very short half-life, like esmolol, you don't give loading dose. So, drug which has got a long half-life, which is having digitoxin, 161 hours. Any small change you want to bring means you have to live another 161 hours. So, you want to give loading dose if the drug has got a long half-life, is what need to be remembered. Aspirin, phenytoin, ethanol, they all have got a zero order. Elimination kinetics is what need to be remembered. Weak acids are excreted better in alkaline urine and weak bases are better in the acidic urine, is what you have to fundamentally remember. Now, if you take the tetracyclines, typically tetracyclines are known to have a drug interaction with the warfarin. Now, doctor, shoot me an answer. Median umbilical ligament is basically a remnant of which embryological structure? Let me see who will answer this. Umbilical? Not vein? Confident? Huh? That's right. Everybody answers the same. It is the umbilical artery. Dr. Madhavi from Hyderabad, everybody say the same. So quickly remember the structures, doctor. Umbilical vein, ligamentum teres. Arteries, medial umbilical ligament. Foramen ovalis, fossa ovalis. Allantois is urachus, is median umbilical ligament. Ductus venosus is ligamentum venosum, ductus arteriosus is ligamentum arteriosum. Oof, that's called anatomy. Ligamentum venosum, arteriosum, teres, medial. That's the reason it is called anatomy. Now, doctor, remaining questions are very easy. Dr. Padmaja wrongly answered it as umbilical vein. I am very happy. And Dr. Madhavi answered umbilical artery. I am very sad. Anyway, doctor, death sentence awarded by the court can be carried out only after confirmation with typically a higher court. Sex best evaluated by pelvis, 90% probability. Hot, humid climate, if we die, then we lead to adiposity. Cutis anserina and drowning should not be forgotten. Now, to control the spread of the shot pattern of a firearm shooting, we use a special component called choking, purpose of it.